Welcome back everyone. We'll be discussing today about the joints, the second part of the joints. So we were discussing about the synovial joint. So I'll just brief it out. We have discussed about the articular cartilage, that is a hyaline cartilage. Outside we can make out the fibrous capsule and the synovial membrane. Both are part of the articular capsule. So articular capsule has got two parts, the outer fibrous capsule and inside is the synovial membrane. And we can see the synovial membrane here. It's lining the inner aspect and we can make out up to the articular cartilage. So it is highly vascular. It is richly supplied with blood vessels and it lines all of the interior of the joint except for the articular surface covered with articular cartilage. And it secretes a fluid that is needed for lubrication of the joint cavity and it is called as synovial fluid. So let's see how the synovial fluid is formed. So I have told you it is highly richly supplied with blood vessels. So from the nearby arteries the blood vessels will be entering, the capillaries will be entering, it pierces the fibrous capsule, enter inside the fibrous capsule and it will be reaching your synovial membrane. The synovial membrane, it acts as a dialysis membrane. It will be filtrating the blood. Blood plasma will be filtrated and that filtrate will be entering inside. Along with this filtrate, the synovial membrane will be secreting hyaluronic acid. The specialized cells in the synovial membrane secretes the hyaluronic acid. So hyaluronic acid along with the dialysate of the blood plasma, that is the fluid. Together they forms the synovial fluid and that provides nourishment to the cartilage. Already we have discussed that. So the functions, it is highly vascular, it secretes the synovial fluid, it liberates, that is specialized cells produces the hyaluronic acid which maintains the viscosity of the fluid. It removes the particulate matter and worn out cartilage by phagocytic activity. So apart from the specialized cells that is secreting hyaluronic acid, it has got various other types of cells like macrophages, so which is having a phagocytic activity and it helps in removing the particulate matter and worn out cartilage. So synovial fluid already we have discussed. It is a viscous and glary fluid. It is a dialysate of blood plasma into which hyaluronic acid is being added. So I have already explained it. What is it? It provides nutrition or nourishment to the articular cartilage and lubrication of the joint cavity to prevent wear and tear. It helps in the lubrication. So while we are moving and all, the synovial fluid is very much required to reduce the friction. In cold temperature, the viscosity increases and this accounts for the stiffness of the joints in cold countries. That means during the cold temperature, in cold conditions, even in our country also, when cold climate changes, the weather changes, when it becomes cold, in the early morning we can feel the stiffness. It is because of the viscosity. What happens is that when the temperature drops, the viscosity of the synovial fluid increases. So what happens when viscosity increases? The thickness is going on increase, it becomes thick. So when the thickness is there, it is very difficult to move. The movement, there will be some stiffness of the movement. It becomes difficult to move. As we are moving on, or when we are out with our activities, that time when the bones they move so fast and when we are doing our movements, what happens is that the thickness reduces. Then the mobility will become easy. So in cold temperature, so viscosity is increasing, which will be resulting to the stiffness of the joint. So more movements of the joint encourages more lubrication. Joint cavity. Joint cavity means we have already told you about the complete structure. So we can see between the two articular cartilages, fibrous capsule will be the surrounding outside. The cavity that lies inside is referred to as the joint cavity. Sometimes the joint cavity is divided completely or partially by an articular disc or menisci. Here you can make out there is an articular disc here which is divided into upper compartment, lower compartment. This is an example. This is temporomandibular joint. Here also you can make out an articular disc which is divided the joint cavity into an upper compartment and lower compartment. Here this is sternoclavicular joint. Here also you can make out articular disc which is dividing it into two compartments. So in both the compartments, separate movements will be taking place. If you are taking TMJ, there will be gliding movements also. There will be the other movements also that will be taking place. Similarly, so when we are having two compartments, the movements will be taking place. Two types of movements will be taking place in each compartments. Ligaments, as we know, what are ligaments? They are the what you can say strong bands that is connecting two bones. So ligaments are of two types. One is true ligament and other one is called as accessory ligament. True ligament means they are actually the thickening of the fibrous capsule itself. Whereas accessory ligaments means they are a part of dense, regular connective tissue. They are the additional bonds of the union between the bones formed by dense, regular connective tissue, whereas the thickening of collagen fibers of the fibrous capsules forms a true ligament. You can make out the ligaments here. This is a ligament which you can see here. As well as the ligaments, it can be intracapsular or extracapsular. Intra means it is lying inside. Example, you can see the anterior cruciate ligament of your knee joint, and this one is the extracapsular, means outside the capsule. So some ligaments are also formed by degeneration of the tendons of the muscles. Here you can see this muscle is called as quadriceps femoris muscle, and you can see it is getting attached to the patella, and further on the tendon is extending down. So the degenerated tendon of that muscle is forming ligamentum patellae. So some ligaments are formed by the degeneration of the tendon of the muscles. Function of the ligaments: it permits desirable movements and it prevents undesirable movements. Maintains the stability of the joint. Here I would like to show you a video. So I would like to show you a video that shows you the movement here. Let's see the movement here. Sorry. You can see here. In this joint, this is showing the hip joint. You can see the ligaments here. You can make out the ligaments here. This is the ligament, and you can see the fibrous capsule also. This is another ligament which shows you, see, extracapsular ligament, and this one is an intracapsular ligament which you can make out. Classification of synovial joints. Usually asked question for the exam point of view, it is very important. So classification of synovial joints. According to the number of bones forming a joint, we can divide the joints into simple joints. Means only two bones are there that is taking part in articulation. So only two bones forms the joints. They are referred to as simple joints. Example, joints of fingers and toes. Compound joint. When more than two bones are articulating, they are referred to as a compound joint. You can make out here three bones are there which is articulating. They are referred to as compound joint. Example, elbow joint. Complex joint. I have already mentioned you about the articular disc that is separating the joint cavity into two compartments. Such type of joint is referred to as complex joint. Example, the knee joint. According to the axis of movement and the shape of articular surface, we can divide it into uniaxial joint. As the name indicates, uniaxial means only one axis is there for the movement. Biaxial joint means there are two axes. Polyaxial means there are multiple axes. There will be vertical axis, anteroposterior axis, and transverse axis. Uniaxial is divided into three types: hinge or ginglymus joint, pivot or trochoid joint, condylar or bicondylar joint. So if you are taking hinge or ginglymus joint, you can see one of the articular surface is convex and the other articular surface is concave, and this is looking more like a pulley. So it moves around an axis, that's a transverse axis. The movement will be around a transverse axis. One articular surface is convex like a cylinder, and the other surface is reciprocally curved, looks like a pulley. Movement taking place here is flexion, extension. Only one type of movement, only one axis is there for the movement, so the movement is like flexion, extension. So hinge, it looks like this hinge joint. Example, elbow joint, ankle joint, interphalangeal joints of the fingers and toes. You can see this is how a hinge joint will be, the movement you can make out here. Flexion, extension at the elbow joint. Pivot or trochoid joint. So you can make out here a ring shaped structure is there, and the other articular surface is like a broad stand, we get pen like structure which is rotating. This type of movement. So movement takes place around a vertical axis, hence only rotation movement is possible. So here rounded or pointed surface, it fits into a ring partly formed by bone and partly by cartilage. That means it is osseo-ligament structure. That will be just keeping the bone in position there. And only rotation movements are possible. Example is superior radioulnar joint, which you can see here, and the atlantoaxial joint. You can see this is a movement that is possible in the pivot joint, the rotational movement, and this is the osseo-ligament structure that is called as annular ligament. And this is another example for pivot, atlantoaxial joint. You can see the rotation movement taking place. Atlas axis. Condylar joint. So as the name indicates, condylar joint is having two condyles which is convex in shape. It is a modified hinge joint. Here it is having the main movement takes place around a transverse axis, and apart from the main movement there is a slight other movement that takes place in a vertical axis. It is partly on a vertical axis. So here one articulating bone, it has two condyles which is convex, and it fits into the concave articular surface of the other bone. And here the movement taking place is mainly in, here is temporomandibular joint example and the knee joint. So here along with the main movement, flexion extension, there will be a slight rotation movements also. You can see here the TMJ, you can see the condyles here, and the movements taking place also can make out. These are the condyles. So this is an example for condylar joint. Here you can see the flexion extension movement that is taking place in the knee joint. This is the main movement taking place. Apart from this, there is a partial movement which takes place. That is the medial rotation. Lateral rotation movements also takes place. Biaxial joint. There are 2 degree freedom of movement. Two types, ellipsoid joint and saddle joint. Ellipsoid joint. In ellipsoid joint, one articular surface is convex, or we can say oval in shape and elliptical. Other articular surface is concave and reciprocally curved. You can make out here. Movement takes place around a transverse axis and anteroposterior axis. That's right, 2 axes is there. And movements taking place will be flexion, extension, adduction, abduction. Example is wrist joint and metacarpophalangeal joint.
Movements possible at the wrist joint. Adduction.
Abduction, adduction movement will be taking place.
Abduction.
Apart from this, flexion, extension is there.
Flexion.
So there are 2 axes by which this movement is taking place. Saddle joint or sellar joint. As the name indicates, saddle is referred to this. You might have seen in horses, they use the structure. So here you can make out that this is convex followed by concavity. So the articular surface of one bone is saddle shape. This is the shape of the saddle. Reciprocally concave or convex, and the other bone will be having reciprocally same concave or convex structure. So here the flexion and extension takes place around a transverse axis, whereas adduction, abduction takes place around an anteroposterior axis. Example, the carpometacarpal joint of the thumb, sternoclavicular joint. You can make out here the sternoclavicular joint, and the malleolar joint. So saddle or cellar joint.
In the
Make out
hand,
the
the
movement.
thumb's saddle joint lets the thumb cross over the palm, making it opposable.
Next is a polyaxial or multi-axial joint. In a polyaxial or multi-axial, as the name indicates, it will be having multiple movements possible. Polyaxial movement, it has 3-degree freedom of movement. Vertical axis is there, anteroposterior axis and transverse axis. It is more or less it is referred to as a ball and socket variety or spheroidal joint. One of the articular surface is bowl shaped and the other articular surface will be a socket shaped. Example for this is your shoulder joint and your hip joints. So all the movements possible here is, as you know, in your shoulder joint, flexion, extension, adduction, abduction, rotation movements and circumduction is possible. So example is shoulder joint and hip joint. Non-axial or plane joint. Here both the articular surface is flat or it produce, you can make out here the articular surface will be flat and they are just gliding over each other. So intercarpal joints, intertarsal joints and facet joints of the vertebrae are the examples. You can see this is how the gliding movement will be. Nerve supply. Articular capsule and ligaments possess rich nerve supply. Acutely they are sensitive to pain. Already I have explained the watchdog action of the articular capsule. What happens when the ligament, when the nerve is being stretched or the articular capsule is being stretched in the last video. Articular nerves, they contain sensory and autonomic fibers. That is sympathetic fibers that will be supplying the blood vessels. So they are vasomotor in function. Some sensory fibers, they convey proprioceptive sensation. Proprioceptive sensation means they are concerned with the position as well as the movement of the joint. So they are concerned with the reflex control of the posture, locomotion and perception of the position and movement. That means proprioceptive sensation, these fibers, they will help us to make out whether what is the position of the joint, how the movement is taking place at the joint, and it helps to protect the joint. It prevents the excessive movement of the joint. Hilton's law. It is a principle in anatomy. It is named after the British surgeon John Hilton. And it means a nerve supplying a joint. It supplies the muscle surrounding the joint as well as the skin surrounding the joint. So nerve supplying the joint also supplies the muscles acting on the same joint and the skin over the same joint. Blood supply of the synovial joint. So we can make out here wherever a joint is there, there is a group of anastomosis formed there. So arteries lying close to the joint forms a rich plexus around the joint that is referred to as periarticular arterial plexus. From these plexus, the small arteries or the vessels pierces the fibrous capsule. This also I have discussed earlier. They forms rich vascular plexus in the deeper part of the synovial membrane. The blood vessels terminates around the articular margin in a fringed looped anastomosis, and that anastomosis is called as circulus vasculosus. And further I have told you what will happen when from there what happens to the blood. Blood will be filtrated, the blood plasma that will be filtrated or dialysate through the dialysis membrane, synovial membrane which acts as a dialysing membrane. It will be entering inside and along with the hyaluronic acid it will be forming the synovial fluid. So it supplies the capsule, synovial membrane and epiphysis. Clinical anatomy. Stiffness of the joint related to weather. I have told you why the stiffness is there, because of viscosity. In cold temperature the viscosity increases, which will be leading to the stiffness of the joint. Osteoarthritis and rheumatoid arthritis. Osteoarthritis, it is a degenerated bone disease in which the articular capsule is being degenerated. So what happens is that there will be, while we are moving, when there is movement, what happens is that the bones, they rub each other, there will be friction, there will be pain. Rheumatoid arthritis, it is an autoimmune disease. Inflammation of the synovial membrane can be seen here. That means the body is on immunity. It attacks the joints. So here the inflammation of the synovial membrane is there. This inflammation is going to affect the nearby bones. There will be bone erosion. There will be deformity of the bone. So osteoarthritis, it occurs by age, wear and tear of the joints over the time. It is gradual over the years and asymmetrical, means only on one side it is mainly affected. It worsens with activity, improves with rest. Why it is worsening with activity? Because when we are moving, what happens? That is no articular cartilage. Articular cartilage is being degenerated. So the bones will be rubbing against each other and there will be severe pain. Rheumatoid arthritis, it is an autoimmune disease. It is sudden or gradual and occur at any age since it is an autoimmune disease. Symmetrical means joint involvement is symmetrical. Both the sides are equally affected. Commonly affected joints are hands, wrist, feet and knee. It improves with activity, worsens with rest. Because why it is improving with activity already have discussed. Then another clinical aspect related to this is called as Charcot's joint, also known as neuropathic arthropathy or neuropathic joint. It's a condition characterized by the breaking down of the bones, muscles and joint due to the nerve damage. It is a joint that actually what is happening is that here the nerve is being damaged. The nerves is not working, nerves is getting damaged. So what happens? The patient will not feel the pain. So if a patient, suppose the patient with diabetes or Tapes dorsalis, leprosy are mainly affected by this. So the nerve is being damaged. What happens when a nerve is being damaged? Already Hilton stroke. So what happens? The muscles surrounding that is going to be affected. The skin surrounding that is going to be affected. So the patient will not be feeling the pain. He or she will be doing his daily activities and it will be damaging the joint. But they will be unaware of this unless they see some external bleeding. Some case scenario related to this. So this is how the case scenario will be. So finally we'll have to describe the general structures of the synovial joint and explain which parts are likely affected in this injury. So here you'll have to explain about the entire structure of the synovial joint. Already have discussed about the parts. So the entire structure will have to explain. So that's all. Thank you. So I hope you have understood the class. Thank you.